Don't want to forget to do that so people can see it later. So you guys know I did finally get last week's up on my website. So if you missed last week, you can go on my website, thevetitude.com, and it's in the blog. It's the most recent blog under the blog subheading. So it's there for you guys. But we're going to get started today. So let me turn on my screen share here. So this is a presentation I've done a couple of times before, and I did it before the whole COVID thing. So there are some things on here that we are not going to be able to maybe take advantage of in this day and age, but hopefully we will be again soon. But I think this is a really important topic. Trust in general is very important for us as veterinarians. I see a lot of stuff out there. I always wanted to find, there was a cartoon that I wanted to add to this that I've seen before, but I couldn't find it. It's like, it's a cartoon of a veterinarian with a client and a cat, I think it was, on the table. And the client is like, "Are you sure?" And then the doctor is like, "Wait 1 second." And he walks away and comes back with his little diploma that says DVM. And we would love it if that was enough. Like, we would all, I'm sure, really love to have the fact that we're wearing a white coat, that we have the letters DVM after our name. We would love for that to just be enough for people to trust us. But that's not the way of the world. That's not how we gain trust. Trust is about a relationship. It's about a series of interactions. In GP, we have a little bit more of an advantage because we have time to build trust and build a relationship oftentimes, because they come into us when hopefully as puppies or kittens when they're healthy, and we have a little bit more leeway to build trust so that when they are sick, we already have that relationship with clients. If you're going to work ER, then you usually don't have a pre-existing relationship. And quite honestly, even in GP, a lot of people don't come in until their pets are sick. Or you might be covering for someone else. Maybe you're a relief vet, whatever it is. There are a lot of situations where we're meeting people for the first time and we have to get their trust. And hold on, I want to pull up, I wonder if I can pull up the chat so I can see if you guys have questions. Where is it? Chat. Oh well. All right, so we're gonna pull up and go to our slideshow. Here we are. Presenter, no, not presenter view. Play from start. All right, so getting clients to trust you, stat. So again, trust is about more than the words you say or what you wear. I mean, in theory, Jasmine should have trusted him more because he had more. Prince Ali had the look, he had the credentials, he had all of the things going for him. But she didn't trust Ali. She trusted Aladdin, because there's a lot more to it than the words you say or the clothes, the white coat on your back or the scrubs, whatever it is. So trust, what makes us trust one person over another? Like I said in my introduction, trust is a bank. It's something that we, over time, we start to feed the bank. Each little interaction that we have with a person. Hold on, some more people coming in. All right. Okay. So each time we interact with a person, we either add a penny to the trust bank, or we wind up taking one away from taking something away from the trust bank. We do something or say something that makes a person trust us less. And over time, when you need someone to trust you, you can either, when you ask them to do something or you ask them to trust you, it's like making a withdrawal from this bank. So why do we need trust in veterinary medicine? Hold on. Well, a couple of reasons. One, trust improves efficiency and decreased costs, right? So we saw this. A lot of you are really young, so I don't know how many of you remember the days of um, traveling pre 9/11. Is there anyone in here who remembers traveling through an airport before 9/11 hit? Bueller?
Vaguely.
Bueller? Vaguely, yes. Okay. So it was a whole different experience, and you got through the airport a lot quicker. You just walk through real quickly, and you'd go through the little metal detector that looks like this, and you'd just be on your way. And then something happened that broke the entire country's trust, right? We lost trust. And with that trust, we lost efficiency, and flights became more expensive because we needed to add more security. Everything took longer to get through TSA. So there was a huge, actual, tangible cost to that break in trust. And that happens in medicine and in life too. When we have more trust, we're more efficient, we have fewer costs. So this is a dog I saw once that had a bite wound. And something had happened. I forget what it was with the story, but this woman was not very trusting of us, and she waited. Because of that, she waited a long time to come in and get her dog checked out. And by the time she came in, the wound looked like this, all necrotic and gross and disgusting and infected. Well, this wound was a lot harder to treat than it would have been if I had seen this dog 5 days beforehand or whenever it was that it first happened. And guess what? There was a lot more follow-up. We had to do a lot of cultures. The surgery was harder. It was longer. It was more difficult, and it cost her a lot more money. And that was, whereas if this is a person who had trusted us to be, and that wasn't anything that was specific to us. It was just a general, I think, mistrust of veterinarians that she didn't come in originally, where she was just wary in general. And then she came in, and then once we did treat the wound, she kept coming back every day because she thought something was wrong. Then it turned into the opposite. It was like, this doesn't look right. Should there be discharge coming from this wound? And I was like, well, yes, there's a drain in there. The whole point of a drain is to drain discharge. But every day she was back saying there's stuff coming out of the wound. And I'm like, that's supposed to happen, right? And so that took up a lot of my time. And that ate up a lot of costs and recheck charges, right? So her mistrust wound up costing us and her time and money. Why else do we need trust? Trust increases compliance. If any of you are already in practice or have been practicing for a couple of years, you may already have some clients who are regular clients of yours. And most of us have these clients who will come in and know us, and or you'll go into practice and you'll have that veterinarian who's been practicing for 40 years, the practice owner who knows everybody, and people come in and they only want to see them, and that doctor will be off that day, and you'll come in and the person, you'll tell them all of these tests that you need to run, or you'll give them a recommended treatment plan, and they'll decline everything. And then they'll call up the next day to speak to that other doctor that they know and trust, and they'll, without hesitation, they'll say, the doctor will just tell them, you need to do this, 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 and this, and they'll do it without hesitation, where you spent 45 minutes trying to talk to these people and get them to do something. And we all eventually get those clients. If you're working in a regular GP practice, it won't be long before you have those clients who are regulars of yours, and you've developed that relationship with them, and they trust you, and they just, without hesitation, say, do what you got to do. And that's awesome. Sometimes when it's an emergency, but though, we need to get people to say yes quickly, right? We need to figure out a way to get them to say yes when they normally see the other vet, and where the new vet that they're coming in to see and they don't know us. How can we get that same level of compliance with them, and how can we increase their trust? Right? Another reason we need trust, when people trust us, they're less defensive and they're less likely to blame us if something goes wrong, right? You know, if they trust you and they believe that you care, if something goes wrong, they're not going to blame it on you. You know, you're not going to wind up with this terrible review, which I should have, I forgot to black out the name of the doctor. I better do that. But this was a review at our practice. Dog came in and was boarding. And on the last day of boarding, he started to seem a little bit off, but like nothing specific, maybe just wasn't quite himself. And he went home and he wasn't quite acting right. And the clients brought him back and there was just something not right. And immediately they thought something, maybe, you know, they asked if something had happened while he was boarding, if it could have been an infection that he picked up, if it could have been something wrong. And the doctor who was on was got a little defensive, right? And he's an excellent doctor, a mentor of mine. I love him very much, but he got a little defensive and about them questioning whether or not we did anything to their dog, which is understandable. I mean, that is something that can easily be taken personally. But there was a significant breakdown in trust here, to the point where now these people were convinced that we were hiding something, right? And so it turns out that this dog had dilated cardiomyopathy and was going into heart failure, probably from the stress of being boarded, but not anything specific that we did. And it would have happened very soon because this dog had very severe cardiomyopathy. And he went to specialists, and the specialist told him this was a pre-existing condition. This wasn't anything that we did, but the trust was broken. And so these people automatically came to blame us. Whereas if we had maybe handled this a little differently and found a way to, build that trust with them in the initial situation, maybe taking their concerns a little bit more seriously, this could have all been avoided. And this review was just one part of, the badness that happened because of that. So we definitely need to try to get people, because people don't leave bad reviews or sue people or make board complaints against people that they like. Right? So we need trust, but what is trust? We're going to start by talking about the physiology of trust. Right? When we have high levels of cortisol, we trust less, right? We get into fight or flight mode, right? And maybe we trust our core group of people, the people that we already know, but people that we're not as close to, people who aren't members of our tribe, that high cortisol level automatically puts us into us versus them, gets us to try to, like, in more of a defensive mode, and it shuts down that trust and it makes it hard for trust to be built. Right? It activates the amygdala, which is the fear center of the brain, right? So if we're fearful, obviously trust is going to be hard. You don't trust someone that you're afraid of. Right? We become more reactive when our amygdala is activated. We become more defensive when our amygdala is activated. And most people who are coming to the vet are high in cortisol, right? I mean, maybe not if they're coming to you for their new puppy. That's usually a good time, although even then, a new puppy is a lot of work. And if they haven't had a dog before, or they haven't had a cat and they've got a new kitten, they've got a lot of questions, and it may be a happy time, but it can still be a stressful time. So people tend to be high in cortisol when they come to us, which puts us at an immediate disadvantage. I love this video.
You see, petting your dog is one of the most relaxing things you can possibly do. It releases a hormone called oxytocin, which reduces stress. Also, it lowers your heart rate and it lowers your blood pressure. Plus, people who pet their dogs are 5 times more likely to live longer than people who just have cats. Plus, the dogs like it so much, and it's a nice bonding experience. That's right. Good daddy, little boy.
I never get tired of watching that. But this is sort of based on fact, as funny as it is. Petting dogs increases oxytocin. So we've got that going for us, right? Because we're surrounded by oxytocin. And oxytocin, if you don't know,
You see,
which you
petting
probably
the
do,
dog,
oxytocin increases trust, right? Because it's the bonding hormone. Oxytocin supports bonding. It supports neocortical functioning, which means that we have improved analytical abilities and improved verbal abilities when we're higher in oxytocin, which means that if our clients are higher in oxytocin, if we can find ways to increase oxytocin in our clients' brains, we can make it easier for them to understand what we're talking to them about. Their ability to comprehend what's going on increases, right? So how do we increase oxytocin? Well, this is the hard part, because right now we're in a situation where we're not mostly directly interacting with clients these days. And most of the ways that we increase oxytocin include our immediate environment or our interactions with clients. So a lot of this is going to have to kind of be put on the back burner for now. And this may be something that we're not able to do so much right now. I did put out, if you go to my website, something that talks about how to better connect with our clients during curbside service to try to combat this. But we are at a distinct disadvantage here when it comes to dealing with clients, because we can't interact with them, and it does definitely make it harder for us to gain their trust. But some ways that we can increase oxytocin in normal life: we can let them stay with their pet, right? Because we just saw that one of the best ways to increase oxytocin is by petting your little land shark chihuahua, right? He's trying to bite your hands off, but you still love him, right? So the ER that I work at, where I do am part-time, generally, COVID notwithstanding, has an open hospital policy. Clients come directly back into the treatment room with their pet and stay with their pet for as much as they want to be there. And that's scary to a lot of people, right? When I tell people that, they're like, oh my God, that is terrifying. I would never want to do that. But once you do it, you don't want to go back. Because I have to tell you, life is so much easier. Clients are so much more appreciative. They are so much more compliant. They are so much more grateful for everything you do when they stay there with their pet and can see what's happening. And there are a lot of reasons for that, but a big one is because, again, they're coming in, they're high in cortisol, they're freaked out, they're scared, and one of the best things that we can do to combat that cortisol is increase their oxytocin levels. And one of the best ways we can do that is by letting them continue to pet their pet. Again, we can't do this right now. And I've definitely noticed how much harder it is, especially during euthanasias or giving bad news, when I can't just reach out and put a comforting hand on someone's shoulder. Or even just when they first come in, reach out and shake their hand. That touch is definitely been shown to be one of the greatest ways to increase oxytocin. When we touch someone, when there is physical contact, it releases oxytocin. So that hug with someone when they are euthanized, after they euthanize their pet, that handshake when they come in, when they first come in, those are powerful bonding tools that we have at our disposal during normal non-COVID times. Unfortunately, again, right now, that's not really an option for us. Play relaxing music. Again, we can't really do this. I mean, we can play relaxing music in the clinic, but most people are not now in the clinic. Warmth. So we release more oxytocin when the temperature is warmer. Of course, we want to keep it at a comfortable level for our patients, but if you can just turn up the thermostat a degree or two in the waiting room where the clients are sitting, that will prime them to be able to release more oxytocin. And of course, paying attention to people. Eye contact and the simple act of paying attention to someone releases oxytocin. When they feel that they're being heard and listened to, they release oxytocin. So these are all things that we can do. Not right now. I hate curbside service. I'm going to be honest. I keep seeing people post about how can we keep curbside service forever. And I was like, no, because it makes everything in dealing with clients more difficult. You have to deal with them less, but the actual interactions are so much harder. And this is why. So what is trust, right? Now, we know why we need it. We know physiologically what's happening in our, some of the physiology behind it. But it's not just a series of chemical reactions, right? So trust in someone is the belief that something you value is safe with them. So people value their pets. They want to believe that their pets are safe with us. They also want to believe that we're not taking advantage of, them financially, right? So trust, when you break it down, there are really 4 fundamentals of trust, 4 components that someone uses to determine whether you are trustworthy or not. When someone's deciding if they can trust you, they look at your capability. Are you able to do the job? Your reliability. Do you do what you say? Do you follow through? Your integrity. So are you honest? And your empathy. Do you care? These are the 4 things that you need to show someone in order to gain their trust. That's it. 4 things. 4 things, and people will trust you. So capability. Do you have the knowledge? Well, that's where that DVM degree from that little cartoon does come into effect, right? But that's kind of a given. When people come to you, they already assume that you have that knowledge. That's why they're there. So that one's an easy one, but it's only one small part of it, right? There's so much more that we need to do, right? Do we have the skills? Do we have the resources? Are you professional? All of these things are determining your trustworthiness. And again, it's not just, and this last one, are you professional? This is a picture that a friend of mine took. She moved and she had to find a new therapist. And she went and was sitting in the therapist's office, and she was sitting there and she was waiting and waiting. And while she waited, she happened to notice that when she looked under the chair in front of her, across from her, there were all these dust bunnies underneath. And suddenly she started to question, well, if they don't pay attention to these little details, they're leaving all those dust under there. If they can't, focus on the little things, what are they missing when when they're dealing with me? So that's professionalism. And those little things are things that people judge you on too. Reliability. So are you there when the client needs you? Well, if you're an ER vet, this one is a little bit easier because the whole point is you're there when they need you, right? Their regular vet is closed. They don't know what to do, and you're there. So, but if you're GP, we all know that you can't be there 24/7. You can't be there for every client every time they need you at that exact moment. So we need to find ways to make sure that even if we can't be there physically, we are there for the client when we need them. Maybe that is offering a telehealth service. So if they call and the office is closed, they get put through to a teletriage service where they can call and say, this is going on with my dog, and a veterinarian or a technician can tell them, you need to go to the emergency clinic, or this can wait until tomorrow unless you see ABC signs, right? Or it is, having a direct relationship with a referral facility, because obviously you can't be there all the time, but you need to show the client that in some way you're going to be there for them when they need you. Do you deliver on the promises you made? So So promises can be direct, right? This is why you never, ever, ever promise someone an outcome. You never say, your dog is going to be, I promise you your dog is going to be fine, right? When someone comes in and needs a dental on their dog and they're worried about anesthesia, you never ever say, I promise you it's perfectly safe, they'll be totally fine. Right? Because God forbid that is the 1 in 10,000 dog that has an anesthetic reaction and dies under anesthesia. You can't make promises in medicine. You never know what the outcome is going to be. So don't make direct promises like that. But promises can also be implied. And sometimes people hear promises where you don't think you made one. So, for example, you say something like, I'll call you with you hospitalize someone's pet and say, I will call you in a little while with an update. Well, maybe to you, a little while is in 3 hours when you have your lunch break, and to them, it's in a half an hour. And you tell them you're going to call them soon, and you don't call them for 3 hours, that client feels like you've broken a promise to them. So you need to be clear. So again, our expectations clear and realistic, right? This is a table that was done by that shows us the results of a study about how often people want to be updated about their pet's health status when their pet is hospitalized. Right? So 35, 27, and 8, so that's 35. So about 70% of people expect an update more than 4 times a day, more than once every 6 hours. Now, I work at a bunch of different animal hospitals, and there are very few animal hospitals where I have the ability to give an update once every 4 to 6 hours or let alone every hour, right? 8.4% of people want an update every hour. Well, that's not realistic. So we need to be clear about that up front. We need to let them know when they can expect a call. So a lot of times I'll admit a patient in the hospital on ER and my shifts end at 6, and I'll tell someone, I'm going to give you a call before I leave at the end of my shift. My shift ends at 6. But if I'm working on a Sunday, 6 often turns into 8, 9, 10 o'clock. So I'm sure to tell people my shift ends at 6, but a lot of times I'm running over. So I'm going to give you a call before I leave, but it might not be until 7 or 8 o'clock. I want to be very clear and direct about when they're going to get that update. So the same goes for prognosis. You need to be clear about the prognosis and let them know exactly. Obviously, we don't know exact, some people want an exact percentage. You can't give an exact percentage most of the time. But we need to be clear about the prognosis. And this is a hard one for me a lot of times because you want to be the hero. You have a really sick pet who comes in and who has a guarded prognosis, but has a chance, maybe it's a heat stroke or something like that. And you want to be the hero. So you might not be subconsciously, I know sometimes I have a tendency to maybe downplay how serious of a condition it is because I want to be the one who saves the day and saves that pet, and I want the opportunity to save that pet. So we need to be realistic about prognosis, right? Because if we tell someone that their pet has a pretty good chance of making it through and they don't, that's not good. Right? We want to be clear and realistic about the side effects, right? If you put a pet on prednisone and you're not clear about the fact that this dog is going to have to pee 18,000 times a day, and they get that dog home and they work a 12-hour shift and they come home to 4 or 5 accidents in their house, they're going to be pissed at you, right? So we need to be clear about the side effects and what to expect with medications. We need to be clear about cost, right? Provide treatment plans up front. And if that treatment plan can change, let them know that that treatment plan can change. A lot of times, again, in the ER, a pet comes in and I don't know what's wrong with it. So I need to make an estimate for, the dog comes in vomiting. And I'm doing x-rays and blood work to make sure that there's not a foreign body or kidney failure or something like that. and I'll make an estimate, and I think that the dog has probably got gastroenteritis, so I'm going to say we're going to look and make sure that we don't see any of these other bad things. If everything comes back normal, we're going to do some outpatient care with sub-Q fluids and Cerenia, and I'm going to give you an estimate for that. But if I find something on the x-ray and your dog needs surgery, I'm going to need to make you a new estimate, right? This estimate is only good if the blood work and the and the x-rays come back clear. We want to be clear about that. So we don't give them an estimate for this, a $600 estimate for a workup, and then go, oh, by the way, your dog needs $3,000 worth of surgery. Because if that might have changed what they did in the beginning, right? If they weren't going to be able to do $3,000 of surgery, they might have said, well, let's just treat for the treatable and not waste our money on this x-ray. Or they may have wanted to put those resources towards treatment instead. So we need to be clear, right? Because we want people to know that we're reliable. Follow-up, right? So if you have a pet who's going to be a diabetic, or I just posted recently, you may have seen my post about the dog who had the broken leg. He got hit by a car. He had a broken leg. I thought he was going to need surgery, but he didn't. But luckily, they couldn't afford surgery anyhow. So we tried splinting, and that dog needed a lot of follow-up. Even with the splinting, he was going to need multiple sedated bandage changes, and that adds up. So it wasn't just the initial emergency fees that they needed to know about. They needed to know about the fees that were going to be associated with all of those bandage changes and follow-up. If you have a dog with a chronic condition, they need to know that this is going to be a lifelong thing, and what is it going to cost them to have to continue to treat this pet long term. What are they going to have to monitor for this pet for long term? How often are they going to need to come in to see you? We want to be clear about those things up front as much as we can be. Of course, there's always a lot of unknown in medicine, dogs and cats and people, for humans. We don't read the book when it comes to biology and physiology and anatomy, and sometimes things don't go according to plan, but we need to be clear about that for our clients. The third trust factor is integrity. And so mostly we think about that as, are we honest, right? So of course we always want to be honest with our clients. But again, are you giving all the pertinent information? And this has a lot of crossover with what we just talked about in reliability. But are we giving them all of that information upfront, and being upfront about everything that they need to know in order to make the best decision for them and their pet? That's a big part of integrity too. Do your actions align with your words, right? So a lot of times, you might say something like, we're going to do everything we can to save your pet. And then they don't have enough money to treat their pet. And you need to come up with a plan B, or you need to think about euthanasia. And that's totally normal. Obviously, we know that we can't foot everyone else's bill, and we know that we can't be expected to pay for everyone. But if we tell someone that we're going to do everything we can to save their pet, and then say, oh no, I can't save your pet because you don't have the money, that's going to get us into trouble. So I'll usually try to say something along the line, I'll try to be reassuring to people, and make them feel less guilty if they don't have the money. But a lot of times I'll say something like, we're going to do everything we can with the resources that we have. And that money is a resource too, of course. There are things that we can and that we can't do. But we need to make sure that the things that we're saying, our actions and our words are aligning. And I know that we often mean to, but sometimes we wind up, saying things that don't match with what we're able to do, despite our best intentions. Values are something that I like to talk about a lot, and I think it's really important that people figure out what their core values are personally, as well as their hospital's core values, because again, you're not going to be able to please everyone, and not every client is going to be the right client for you or your clinic. And if you try to please every different kind of client, that's not a sign of integrity, right? That's not how you build integrity, by doing different things for different clients and bending over backwards and doing things that don't align with your values. So you need to figure out what your values are so that you can practice by them. So if that open hospital that I work at, that ER, that's an open hospital, transparency is one of their values, right? So we need to be transparent. That's why people come back. Maybe one of you, your your values are going to vary, and so you're going to attract a certain kind of clientele. And so there are people that you're not going to make happy that aren't maybe going to trust you. But if you live by your values, you will get the people who fit with those values, and they will be drawn to your integrity and the fact that you do what you believe in. Can you admit when you're wrong? This is a big one, right? For a long time, the prevailing theory in medicine was that an apology was akin to admission of guilt. Right? And so we were told, and human doctors especially were told, never apologize when something goes wrong. Well, studies show that that is a terrible, terrible advice, which we should have known all along. Anyone who isn't a lawyer probably knew all along. People want you to admit when you're wrong. They want you to say you're sorry. They want you to apologize. And if you make a mistake and you apologize for that mistake and you admit it and you tell them what you're going to do to make it right or to make sure that it doesn't happen again, they are much less likely to sue you than if you don't admit your guilt and stand, and don't say anything and don't show that empathy or aren't willing to admit your mistake. Are you willing to listen to others? So I have a patient who has megaesophagus, and the owners are on a megaesophagus support group on Facebook. And they came to me after diagnosis and said, people on my support group keep saying that I should try sildenafil. And I was like, sildenafil? Your dog doesn't have erectile dysfunction and he doesn't have pulmonary hypertension, so why would we use sildenafil? And it would have been easy to dismiss them. But what I said instead was, I haven't heard of that, but let me look into it for you. And I did look into it, and I found out that there was a recent study, or recent at the time, that showed that dogs with congenital megaesophagus had improved outcomes with sildenafil because it increased lower esophageal sphincter tone. Now, this dog didn't have congenital megaesophagus. He had acquired. But I spoke to the owners about what I'd read, what I learned, what we did know, what we didn't know, and we decided to give it a try. Didn't really help this dog, but it helped because I listened to this client and I didn't just dismiss the information that they came to me with. These clients know now that they can come to me with anything that they read on their board and they can ask me about it, and I will not dismiss them and I will not make them feel stupid about it, and I will look into it. So when these clients came to me a little while later and said, hey, people on our megaesophagus board keep talking about feeding raw. Should I be feeding Al raw food diet? And I wanted to do one of these cases, but I didn't. But I did say, I don't think that's a good idea. There are a lot of bacteria in raw food, and you know that your dog is prone to aspiration pneumonia. We don't want him to aspirate salmonella, right? They said, okay, good. I won't feed raw, because I'd established a trust, and they knew that that I wasn't just going to dismiss it if it wasn't something that I knew. All right. And arguably the most important of the 4 trust factors is empathy. Right? Do you care about the patient? That's an easy one, right? For most of us, it's easy to care about our patients. That's why we went into veterinary medicine. But do you care about the client? This one's a lot harder for a lot of people. A lot of times we view I know a lot of veterinarians who have a rather combatant view of clients. Right? But we need to care about the client as well as the patient. Also, do you care about your staff? People take note of that. They take note of how you treat your team. I was sick a couple years ago and I went to the walk-in clinic, and there was one doctor and one medical assistant on. And the medical assistant came in to draw my blood, and she was relatively new and she couldn't find my vein. And she went to the doctor and she said, listen, I can't find her vein. And the doctor came over, and she didn't just like huff and puff or push her out of the way or get frustrated or annoyed. Instead, without using me as a pincushion, she showed her where the vein was. She let her feel it. She taught her. And she misdiagnosed me. She thought I had gallstones and I did not have gallstones. That is still my favorite doctor of all the doctors that I saw when I was sick, because she showed that she cared about her team member. She was there. She was patient. She was kind. She was compassionate to her team member. So I knew that she was going to be patient and kind and compassionate with me. People see how you treat others, and they infer how you're going to treat them by how you treat others. This is a popular statement, which is 1010% true. People don't care how much you know until they know how much you care. No, you can't get a person to trust you just by spouting facts at them. You can't get them to like you. Right? They need to know that you care before they start to trust you. I think we all know that intuitively. So those are the 4 things that we need to be able to communicate to our clients: capability, reliability, integrity, and empathy. So how do we communicate these things to our clients, right? How do we go about that communication? The words that we say, of course, right? But as we saw Aladdin in the first slide, the words only take you so far. Aladdin and Prince Ali said the exact same thing. Do you trust me? And she only trusted one of them, even though they were the same person. The words are important, but they're only a small portion of communication. Our tone of voice. We are going to be relying on this one, and have been relying on this one so much over the last 6 weeks, and probably for the next year or so. Some of us may be doing FaceTiming with our clients or things where they can see our faces, but a lot of communication is taking place over the phone. And so they can't see our body language or our facial expressions. So we really need to rely on tone of voice and make sure that we are speaking with a calm, compassionate tone of voice, right? If you get on the phone and you let your stress and your frustrations show through, that's going to come through, and that's all they have to judge you by. How fast you talk. People make inferences about about what's going on by how fast you talk, right? If you're talking really fast, they might infer that the situation is more emergent than if you're talking slower. The volume of your voice, how loud you're talking. All of these things are communicating something to a client. Body language, facial expressions. And I think the biggest, most left out thing in communication is listening. Communication is a two-way street. So we need to talk to our clients. We need to give information, but we also need to listen, right? We should be listening more than we are talking. In effective communication, you listen more than you talk, and that is a big one that we often leave out. So, specifically, if we want to communicate empathy, what are we looking at? When you're trying to convey empathy, you want to speak slower. You want to use shorter, briefer sentences. You don't want to just go off on a long diatribe. I have trouble with this one. I love to just go off and ramble. But you want to do short little sound bites because people can only absorb a certain amount of information at a time, right? So 2 or 3 sentences max, and then you stop and get feedback and listen and make sure they've understood what you said. You speak in a softer tone of voice, a warmer tenor to your voice, right? Especially, when it's time to euthanize a pet, right? Your euthanasia voice is totally not the same as think about your euthanasia voice versus your new puppy voice, right? Euthanasia voice is going to be calmer and softer, more understanding versus the excited new puppy voice. We want to improve our nonverbal cues. So that's our body language and our facial expressions. And we want to be present and listen to our client. But when I put this list out in front of me, I see a big problem. Because this last one, be present and listen to the client, that's the one that I think is the most important. But how do you do that? How can you be present and really not just hear, but listen to your client while in your head you're thinking, I have to slow down. I can only talk a couple of sentences at a time. I'm speaking too loud, right? What's my face doing? Am I making any weird microfacial expressions? What's my body doing? Am I using open body language, right? If you're thinking about all of these things and you've got all of these things going on in your head at the same time, then you can't be present. And so there's a bit of a conflict in here. So the number one piece of advice that I have is that we need to relax. Right? And that's hard, especially when a pet is really sick or there is a lot going on and it's a stressful day, but we need to find a way to relax because usually when we're not conveying empathy, it's because if the reason that those things, those facial expressions and body language and tones of voice relay empathy is because that is what our minds and our bodies and our voices do when we're being empathetic. And so if we're not naturally conveying that, that's because there's something there that's blocking us. So I'm not saying you're not empathetic. You definitely, I'm sure, care about that pet. You probably care about that owner. But if that empathy is not coming through, it's probably because you've got 8,000 different things on your brain and you're just too stressed by other things to accurately convey the empathy that you're feeling. So if we can relax, we can let our natural empathy shine through and not have to think about it so much. So how do we relax? Oh, a massage. I miss massages. I miss my Massage Envy membership. Relax. So we need to learn to compartmentalize in veterinary medicine. Obviously, we don't want to over-compartmentalize. We need to be able to process the things that happen in our day, but we also need to be able to go from that new puppy or kitten exam to that euthanasia, right? And then from that euthanasia to the, the senior dog wellness. And you can't go in and be all excited about the new puppy and still be thinking about that euthanasia. You have to turn it off. You need to stop, and take a minute and close one door and then go open another. And you can open that other door later on during your break or after work or whatever to process that really painful, terrible euthanasia. But at that moment, we do need to learn to compartmentalize. Self-care, of course. We talk a lot about self-care in veterinary medicine these days. But we need to take care of ourselves, right? If we're overworked and overstressed and burnt out, then we're not going to be able to relax and we're not going to be able to be present and empathetic with our clients. Breathing exercises. A deep breath can really center you and bring you back into the moment if you find your mind wandering. There are muscle relaxation techniques that you can use, right? So you tense up all your muscles and then let it relax. I mean, that's the most basic. There are more advanced. But those muscle relaxation techniques can bring you back to it brings you back to the physical, the deep breathing, the muscle relaxation. Those things bring you back into the physical so that you can stop your wandering mind and be more present in the moment. We're veterinarians. Go pet a dog or a cat, right? We can do that. We already talked about how that releases oxytocin. It releases it for the clients. It releases it for us too. I'm lucky. I get to bring Frankie to work with me every day. So petting your own dog is the best. But we've got lots of dogs around. So sometimes when I'm having a really bad, stressful day, I just go back into the kennel and snuggle a cute kitten or a dog. And it's awesome. So that's a great job perk that we've got. And of course, have fun. Work is work, but you can have fun at work, right? I sing constantly. No one who's here right now works with me, but if they were, they would attest to you the fact that I break out into song all the time because I'm having fun, right? I mean, yeah, bad things happen during the day, but you need to be able to just not be so serious all the time. Otherwise, you will go crazy. And be confident. This is the hardest one. This one is really difficult, but you need to be confident. And the best advice I can give you in being confident is to be confident about what you don't know as you are about what you do know. What I mean by that is know that it's okay to not know something. We are never going to have all the information. There's always going to be something you don't know, no matter how on the top of your field you are. You could do a residency and become one of the top neurologists in the field, and there's always going to be some new piece of information that's going to come out. There's always going to be something that you don't know. And so you need to get okay with that. And you need to be confident when you tell a client, I don't know, but I'll find out. Because if you can say that, then you don't have to worry about it. Then you can go out of the room and do your research or call them back later. And not be so worried about having, when you think you have to have all the answers, all you can do is think about what are they going to ask next and am I going to know what to say? And you can't just stop and be present. So accept that you're not going to have all the answers and be confident in saying, I don't know, but I'll find out. And that's it. That's all I've got for, perfect timing. It's 9:56, so almost an hour exactly. Great. Anyone have any questions or insight or inputs they want to give? I think I have my chat. How do I get out of here? Oh, stop screen.
Is it okay if we use our mic to ask you?
Sure.
Okay. Hi. So, I am a people pleaser. It's deep stuck inside me and I need to beat that. Cause I can find myself,
Right.
saying things word vomiting a little bit.
Yep.
So did you find just going into practice and kind of trial by fire practice, or did you have any way to practice with other people, communication with clients to kind of?
For me, it was a little trial by fire. I think it's great. I know there's a lot more communication being taught in school. I did not have any communication classes. I did have experience when I was younger, I was in student government and I was, in those kinds of things where I took a lot of leadership and I went to leadership conferences and stuff when I was younger. So I had some of that training then. I did not really get any in vet school and I had to learn about that a lot. And honestly, when I graduated, I had a lot of social anxiety and it was difficult for me. So it is something that with practice that you get better at. As far as people pleasing goes, I do have an entire lecture on boundaries that I hopefully will get around to doing, but I think that that's an important one. One of the things I talk about in my boundaries lecture is remembering all the reasons that saying no or setting a boundary is not only good for yourself, because it'd be great if we could set boundaries because it's the right thing to do for us, but sometimes we need to remember all of the reasons that saying no or, not immediately pleasing the client is in the client's best interest. So, if you work 60 hours that week and someone comes in with their cute little golden retriever puppy, right, that ate 2 rocks and a lug nut like the dog that I saw on ER the other night, and they come into you on your GP and just as you're closing, and they get mad at you because you don't want to stay and cut that dog. Well, you need to remind yourself not only that you want to get home and get some rest, but that, if you're overexhausted and if you make a medical mistake, because medical mistakes do go up, when you're overworked, you don't want to be the doctor who has a slip of that knife and accidentally slips and cuts the spleen and the dog bleeds out or has some medical mistake. So you need to remind yourself that you're saying no as much for their benefit as for your own, and that while it may not be immediately the best thing for the client, it usually is. Setting those boundaries is the best thing in the long run for them. Even if it's like, this is a client that you can't please at all, then the best thing for them is to go to another vet who does practice more in line with them, right? So you may piss them off then, but it's in their best interest long run to find a veterinarian who's more in line with what they want to do. And it's tough, but just keep reminding yourself of that, of all the reasons that saying no or not immediately pleasing them is good for them too, right? You're pleasing them, just not right away.
Right. Not exactly the way they want right now.
Yes.
No, that's all.
They may not know it, but it is better for them in the long run. Anything else? All right. Well, thank you guys for coming on. I will try to get this one on the website too. Took me a whole week to get the last one up, but hopefully the kinks have been ironed out. So this one will be up quicker. All right. Thank you. Bye.
Thank you.